Hi, Dr. Brian Laskin from Upgrade Dental here, and I'm very excited to launch a new category of tools into dentistry, UVC sterilization. It's coming in many forms right now. At the time of this recording, we're relaunching offices, reopening them from COVID-19, and things have fundamentally shifted, similarly to the AIDS crisis in the 80s, where patients are much more focused, and teams and dentists obviously are much more focused on infection control. And I think it's very important to recognize that this isn't just the dental team, but like I said, patients are also focused on that. And that'll factor into kind of how we talk about this particular UV light today, the PurLite. So let's get right into it. Starting off with the history of how we got to use ultraviolet light to kill bugs in dentistry in the first place. We've had several sterilizing options in dentistry, primary of which is using single-use items, so we don't have to sterilize things in the first place. And also we use chemicals, obviously, things like Virex and other types of disinfectants to wipe things down, but that takes a lot of time. And some things can't be sterilized with chemical disinfectants. For example, an N95 mask, which has been in short supply during the pandemic, and also quite expensive. So we can save on PPE, save on cost, save on time by leveraging UV lights in the dental operatory. And it's so effective because UVC light is actually 100% effective as a germicidal agent because it causes fatal damage to germs at their genetic level, which is a little bit different than UVB and UVA. UVC light is also proven to sanitize safely and effectively in many leading hospitals globally. There's no microorganisms that can withstand UVC light, and unlike chemical agents, they simply can't develop a defense against it because it acts at their genetic level. PurLite UVC germicidal bulbs are 245 nanometers on the spectrum chart, and it's important in the breakdown of DNA. Now, UVC has been expanding quite a bit during the pandemic. This slide shows a little survey that they did from our friends at Dental Town. It's Howard Fran posted this. He's kind of a great guy, but he posted this survey which shows that about a third of dentists are looking at incorporating UV sterilization into their offices now. A third aren't, and then a third are undecided. So if you think about, even if there's only 25, 20, 30% adoption to this light, that's very different than we were pre-COVID-19. So this just shows a trend that we're going, and so I'm happy to launch this very cool product today. Now, of course, at Upgrade Dental, we run everything through our cost of implementation. So running it through the clinical quality, observations by patients, ROI, and of course, team health. So let's break the PurLite device into those categories, starting off with clinical quality. Well, I talked about it before. We're eliminating 99.9% of germs. Sometimes clinical quality just comes down to pure efficacy like this. If you have bugs, this kills bugs, simple as that. Now, going on to the observations by your patients. Like I mentioned at the top of this video, it's very important to recognize that patients are really looking at every touch point in our practices as a potential infectious source. So even if you put one of these in your reception area and allow them to disinfect their own phones, it's going to show that you really care about your patient's safety, your team's safety. And then when you have them in the back, you can point out that we use UVC to sterilize things like our devices that we use many times, like iPads, if you want to get the bigger one. So it's really important to communicate to your patients the value of having UV sterilization in your practice, and this is a very easy way to do it. And when it comes to return on investment, well, we're going to go through a little chart in a little bit, like we like to at Upgrade, show you kind of the future savings. But the ability to sterilize and reuse PPE equipment, your ROI actually it ramps up pretty quick. And these aren't very expensive devices, so it makes the barrier for entry very low. Also, the marketing value that comes with advertising to potential patients in your office that you use PurLite, again, it just shows that you care about their safety. And that's the kind of experience that patients, it elevates what people are expecting. You go beyond their expectations, and that's what causes, of course, the word of mouth referrals that we're all looking for. Now, as far as your team health, people can sterilize their own personal items. Everybody leaving the office, now we don't wear the same clothes when we go home that we did coming in. You can drop your phone in the device before you leave for the day. It shows that you actually care about your team's health, obviously. And they can use it all the time. It's very easy to use. It takes just a few seconds, so you can use it multiple times a day. And it makes it safe to reuse masks. So your whole office can use it to sanitize their phones, masks, keys, really anything that they come to the office with or before they go home. And you can use it multiple times a day. Like I said, it's a sense of cleanliness and safety at work that really shows to your team that you care. So let's take a look at the compounding results that you get using the PurLite to decontaminate N95 masks in the average dental practice. Well, the average office is about 7 providers working 4 days a week. The cost of a single N95 mask is $3. Now, there's some studies that show that N95 respirators can be decontaminated up to 10 times without causing significant damage to their fit and filtration. But for the purposes of this, I would recommend just using 1 mask a week, like we do in our practice, to conserve on PPE and cost. And that comes down to $9 per mask. Well, every week, if you have 7 providers and work 4 days a week, that's $63 a week, $252 every single month. And every year you'd be saving $3,024. Now, again, the cost of entry for these is very low, so that's a massive savings. And that doesn't even factor into the marketing that you'll get when you communicate this to your team and your patients, of course. But when you are discussing it with patients, I would recommend to talk about how easy it is to use, how fast it is, and really stressing that it eliminates 99.9% of germs, because it's so fast and easy to use that it's hard to imagine how effective it actually is. And you're looking out for everybody's safety. So make sure that your team is aware of it, your patients are aware of it, and I think it will really help to grow your practice. Now, a special tip is that these are pro units made for the dental practice. So we have one that's more for like N95 masks and for phones, but then there's a bigger unit for iPads. Of course, we at Opera DDS love paperless forms, so we use lots of tablets in the practice. And so running them through the larger version like this is absolutely fantastic. You don't have to worry about wiping down and getting streaks on your devices. You can just drop them in there in a few seconds, and it's great. But your patients can actually use a home version too. And when you have this in your reception area and people can drop their keys and their phone in there, they might ask you where they can get one. So I would just have at the ready the link to the PurLite home version for people to use outside your practice. So thank you very much for watching this video. I'm really excited that UV lights are coming to dentistry. I think we're going to look back on the COVID pandemic once we finally get past this, hopefully, and think about the multiple ways that we as dentists have stepped up and taken a leap forward. And I think incorporating products like PurLite and UVC light to disinfect our practices is one of those leaps that we, as an industry, are taking forward. Thank you.